Well, hey everybody. Hey, sorry for the late start, but hey, that's show business. Uh, are you receiving Social Security disability? If you are, you're gonna like this show. All right. Well, like I said, are you on Social Security? I am, and I got a letter here about 2 months or so ago saying that I now have to enroll in Medicare. So if you are on Social Security, receiving disability through Social Security, you may qualify for Medicare, even if you are 100% service connected, like I am at the VA. If you are also receiving Social Security, they're going to make you probably sign up for Medicare. So we're going to do a little thing here. We're going to talk a little bit about Medicare. Then we're going to talk about a few other things after this. But just so you know, there are several parts. There's a Part A, Part B, Part D. Now, let me bring up my notes here so I don't mess up and I make sure I give you all the right information. See, that's key to everything. Having the right information. So, if you are on Social Security and they are going to make you sign up for Medicare, which it's not a bad thing, they'll take the premium for Medicare out of your Social Security check, and it's not much. It varies from state to state, so I'm not going to get into how much it is. But like I said, there's a Part A, Part B, there's a Part C, but we're not going to cover Part C because that's extremely complicated. And most people don't even sign up for Part C. And then there's a Part D. Now, if you're like me, that's 100% service connected through the VA, or maybe like 75% or whatever, where you're getting your prescriptions for free, you do not need Part D. They're not going to make you sign up for Part D. What they are going to make you sign up for is Part A. Okay, then they're going to give you the option to sign up for Part B. Now, what Part A covers is inpatient care in the hospital, skilled nursing facility care, like a nursing home. Well, there you go. The next one is nursing home care. Inpatient care in a skilled nursing facility that's not custodial or long-term care. All right. Hospice care and home health care. We're not going to get into too much of what each one is. They're pretty self-explanatory. Now you're wondering, well, if I get everything through the VA, why do I need Medicare to begin with? Well, one, they're going to make you sign up for it. It's not a big deal. Don't get all your pennies in a bunch. All right. But one is Medicare will start paying the VA if you are placed in the hospital. So that's like a win-win for the VA and actually for us, if you think about it. Because the more money the VA brings in, the less they're um, needing to borrow our taxes. All right. So it's a good thing. Now, if you're like me and you're terminally ill, hospice care, that's probably going to come into my life here one of these days. And knowing that hospice care is going to be taken care of, it's going to take a load off of my wife's shoulders. Because that can get quite expensive. All right. And if I get too sick and I get put into a nursing home, that's going to be taken care of too by Medicare. Now, there's also a Part B, which is not mandatory, but I signed up for it because it's going to cover some stuff that will be taken care of outside the VA if I do not get approved for community care. So, like if I want a second opinion on certain diagnosis on some things, I got Part B to cover that because it's going to take care of medically necessary services. Services or supplies that are needed to diagnose or treat medical conditions. It also covers preventive services such as vaccines, other illnesses, take care of illnesses such as like the flu, COVID, RSV. That's a big one right now. Stuff like that. So look into Part B in case you need, if you think you at one point want a second opinion outside of the VA, Part B will cover that. Now, one thing that I learned that I didn't even know about was new insulin benefit. All right. So let me kind of get caught up here on these here. Right there. I skipped one. So let's go back to it here. This is what Part B covers. Clinical research. If you need an ambulance, like me, I don't live close to a VA hospital, but there is an emergency room downtown. So Part B will help cover that if the VA doesn't. Also, mental health. That's a big thing with me is mental health. It'll cover inpatient, outpatient, partial hospitalization, such as day hospital at the VA, programs like that. Intensive outpatient program services started this in January. And it will also cover limited outpatient prescription drugs that you might need for preserving your mental health. So if they make you sign up for Part A, do a little bit of research and look into Part B, see if Part B is going to help you. All right. Now, like I said, because I skipped too many slides here, I got a new insulin benefit. If you use an insulin pump that's covered under Part B's durable medical equipment benefit, or if you get your covered insulin through a Medicare Advantage plan, which is, I think, Part C, but it's very complicated, and I that's something I'm going to suggest you research on your own. Don't. That's why I didn't include it in this. But the cost for a month's supply for Part B covered insulin for your pump cannot cost you more than $35. Part or if it let me get this right. Part B deductible won't apply if you get a 3-month supply of Part B covered insulin. Your cost can't be more than $35 for each month's supply. So that means you would pay no more than $105 for a 3-month supply of covered insulin. Now, if you have Part B and Medicare supplement insurance, Medigap, research Medigap on your own. All right. That pays your Part B co-insurance you plan should cover the $35 or less cost for insulin. So you might be able to get your insulin for free. All right. So that's a good thing. Now, since I am diabetic and they're thinking about putting me on insulin, me signing up for Part B could be a very good thing for me. Now, there are some things that are not covered by Part A and Part B. Long-term care, also called custodial care. All right. Most dental care. But if you are 100% service connected, you get free dental care at the VA. If not, go back a few episodes and you'll see there's a way to get free dental care. It's through a nonprofit called Everybody for Veterans. If you need information on that nonprofit, contact me. All right. My email will be in the description. Now, of course, it won't cover dentures. Once again, if you need information on the nonprofit called Everyone for Veterans that helps you get free dental care, the email will be in the description. I have all the information you need for them. All right. Of course, it won't cover cosmetic surgery. If you need massage therapy, it won't cover that. Routine physical exams, hearing aids. I wear hearing aids, so good thing I'm 100%. Concierge care. I'm not quite sure what that is, but hey, it's not covered. Covered items or services you get from an opt-out doctor or other provider, except in the case of an emergency or urgent need. So that means if the doctor doesn't accept Medicare is not going to cover any services through them. All right. Now, here comes some very major information that you need. TRICARE. If you have TRICARE, which is healthcare program for active duty and retired service members and their families, you verbally must sign up for Part A and Part B. I don't even know what that word is. But you must sign up for Part A and Part B when you are first eligible to sign up to keep your TRICARE coverage. So look into that. Find out when you are required to sign up for Medicare, so you don't forget and you lose that TRICARE insurance. All right. You don't want to lose that if you have it. So please look into seeing when you have to sign up for Medicare. I'm sure Medicare lets you know, like they did with me, but I don't have TRICARE, so I didn't have to worry about losing TRICARE. But, look into that. Make sure you are educating yourself on this stuff. Be proactive in your healthcare, people. I can't stress that enough. Now, here is another one. Champ VA. If you have Champ VA coverage, you must sign up for Part A and B to keep it. There's the 1-800 number, which I will put in the description as well, folks. So you can get more information about Champ VA. I don't know what Champ VA is. I'm not going to go into that. So, but look, folks, the reason I'm telling you this is I want to see people become proactive in your health care. I guarantee nobody else is looking out for you except for maybe your spouse, your kids. So do it for them. If you don't want to do it for yourself. If you're single, please do it for yourself. Now, I'm going to put something on the bottom here because we're getting ready to move into our next segment of the show. And there it is. Put it on we'll do it this way. All right. Let me go ahead and take this down. What you see there at the bottom of the left-hand screen is a link. And the link will be in the description too, folks. I've started an email campaign to the White House asking for September 22nd to be declared National Veteran Suicide Awareness and Prevention Day. We don't have one. September is National Suicide Awareness and Prevention Month. That's why I'm asking for it to be in September. And the number 22 is in the veteran community. I don't need to give you details on that. That's why I picked September 22nd. Not only did I start an email campaign to the White House asking the president to sign an executive order declaring this date, and I'll get into that in a second, I've started a petition. The link is for that petition. I'm asking you to sign the petition and then share it on all of your social medias. Your Instagram, your X, which used to be Twitter, Facebook. shared on all that. Threads, whatever Threads is. I guess somehow I got signed up for Threads and I have never used it, but hey, if you use Threads, post it on there as well. Now, the reason I'm asking for an executive order on this is I worked with Congressman Dave Joyce and Congresswoman Amelia Sykes and Senator Sherrod Brown, all three from Ohio. Matter of fact, I worked with every federally elected official from the state of Ohio except for two. Two refused. That's Congressman Jim Jordan and Senator J.D. Vance. Them two refused to get involved with this. We're not going to go into it any further than that. I'm not going to discuss that with anybody. That was their option to do, and that's what they did. We're leaving it right there at that. Now, Senator Sherrod Brown, Congresswoman Amelia Sykes, and Congressman Dave Joyce got together per my request, and they wrote a resolution declaring September 30th, 2023 as National Veteran Suicide Awareness and Prevention Day, just for the year 2023. Now, the House cannot vote on that. I don't know, that some rule that both Congresswoman Amelia Sykes and Congressman Dave Joyce stressed to me is that they can write the resolution, but it will get no further than that. It will never come to a vote on the House floor because that is their rule. They do not vote on resolutions like this. This is no problem. But what happens with the resolution after you submit it? And they say, well, we'll request it get sent over to the White House. See if the president will do an executive order. Now, the clerk at the House informed me that it did get sent to the White House. Now, on the Senate side. Now, the reason it got changed to September 30th in that resolution is because it took up until the 28th to get it submitted and onto the Senate floor. You see, the Senate can vote on resolutions like this. But they have to do it every year. And I don't feel like we should have to do this every year. All right. Now, am I appreciative of Senator Sherrod Brown doing this? Yeah, hell yes, I am. All right. And when it got presented on the House floor, it passed by unanimous consent. Okay. But the thing is, it was only for 2023. So hence the new email campaign to the White House asking for this for September 22nd to become National Veteran Suicide Awareness and Prevention Day. I'll get into how you email the White House here in a moment. Because there's some news about the petition. It's growing strength, not as fast as I would like, not as fast as some other people would like, but it is gaining momentum. 100 people signed it today alone. So we're getting places with it. It caught the eye of several state senators and congressmen in the state of Ohio. So my state representatives contacted me and says, hey, well, my state senator contacted me and says, hey, we need to meet and talk about this. My state congressman contacted me and says, hey, though I feel that this is very well needed, please contact these other two congressmen. They are veterans and they will be able to help you out more than I can. So basically, he passed the buck. So I contacted them too, and I heard back from them. And they says, yes, this is very much needed, and we will help you with this. So yesterday I had a meeting with my state senator, Christina Rogner, and we met in person, face to face yesterday, and we were talking about this. And then I started showing her some data, some statistics. And I says, hey, look, Ohio is towards the top of the list as far as veteran suicides goes. And she says, what do you mean? I says, being at the top of the list is not a good thing. It's a bad thing. That means you got an extremely high rate of suicides by veterans in your state. So we were talking a little bit more about that, and I compared our rate to California's. Because the VA says we have close to 800,000 veterans that live here in the state of Ohio. There's another website that says we are around 650,000 veterans that reside in the state of Ohio. I'll explain that here in a second. The VA states that California has 100 million more. I'm not 100 million. I mean 1 million more veterans residing in that state than in the state of Ohio. So they have 1,800,000 veterans living in California. The state of Ohio's veteran suicide rate is at 38.3. The national average on this last report by the VA was 31.4, I believe. So Ohio's higher than the national average. California, their veteran suicide rate was 15%. Still a very high number. But compared to Ohio, it's like crumbs. Because of the veteran population. Because it's based on per 100,000 people. Okay? So as I'm going over these statistics with her, and she's writing these down, and the more I go over these statistics with her, the more involved she's getting with this. And she's saying, do you have it for Colorado? Do you have it for this state or that state? I says, yeah. Colorado, I think, has 680,000 veterans residing in that state. They're at 56.1%. And I already told you what the national average is. And I told her if we went by the amount of veterans that was listed on that other website, we'd be close to 56.1%. And she's like, something's got to be done. So I went over some of the programs that the state of Ohio offers as far as veteran suicide goes. And guess what? There really isn't any. They do have suicide prevention programs, but nothing designed for veterans only. So I told her, by claiming this day as Veteran Suicide Awareness and Prevention Day, this is going to give us a tool to where we can help educate people other than veterans on warning signs and resources available to veterans. Why do I feel that other people other than veterans need to know about this? The VA has been targeting veterans with the Veteran Suicide Crisis Line and other programs to get the veteran to get mental health care. The U.S. government Same thing. When they talk about veteran suicide, they aim it straight at the veteran themselves. So that veteran, he might blow it off. Chances are he does, or she does. But do you think their spouse is gonna? Do you think their kids are gonna? Do you think their mothers, fathers, brothers, sisters, their coworkers are gonna blow it off? No. They're the ones who are going to be able to convince the veteran to get help. When I explained that to her, she says, you don't have to say another word. And I see she was texting. She says, I'm texting my staff right now saying this has to happen. I want them to start working on the bill today. Right now. So my phone goes off this morning. 8 o'clock this morning. And I look at it and I got an email. And it was from her staff saying, Tim, we worked through the night. We have the bill ready. But did you know there was already a veteran suicide day in the state of Ohio? And it was the first Saturday of May. I says, no, I did not know. Matter of fact, when I was doing my research for the last several months on this, it never popped up. Contacted the governor's office on suicide prevention, and they didn't know about it because they sure didn't tell me. And they're like, don't worry. Here's the bill. You tell me what it needs to be added. I says, well, what the old bill needs is to be changed to make September 22nd Veteran Suicide Awareness and Prevention Day. And it cannot be obscured. It cannot be hidden. It cannot be forgotten about. It's going to have to be promoted. And they're like, people like you, Tim, are the ones who are going to help us get it promoted. And they're right. We, you, I, the audience here, we're the ones who are going to get it promoted. So go to this link, sign this petition so we can get it become a national day every year. It has to be done by an executive order according to the Senate and the House. Now, the elected officials here in Ohio that I have talked to in the last 2 days on this, the House in Ohio, the congressman, once I told them that they've already written this bill for the Senate side, says we're going to contact them. We're going to do a joint House co-sponsorship on this so we get it passed in both houses at the same time. Which is fantastic. But short of the goal, people, we want this to happen every year, nationally. Now, another thing that I want to talk about is some of you may have seen it on my Facebook, on Veteran Central Facebook, on the Gulf War Advocate Facebook page, Veterans Insurance Network Facebook page, that we got some donations by 2 major publishers of puzzle books. Now I'm talking crossword puzzles, Sudoku, however you pronounce that, word search, those type of books. All right. For us to take to patients that are in VA hospitals here in Ohio. So we confirmed up the date for Cleveland, VA, Wade Park, also known as Lewis Stokes, because it's originally named after him. Chillicothe and Dayton got a hold of me today and said, hey, this is a fantastic idea. Let us know when you want to come down and distribute these books. So I'm working with volunteers on that, and we'll let you know. But March 5th is when we're bringing them to Cleveland. Now, some of you may remember the last 2 years did a Christmas card drive to bring Christmas cheer to the patients that were hospitalized at Wade Park for the holidays. Now, we did this along with the Cleveland Cavaliers. Lucy and Matt out there at Cavaliers, Cavs Care, and their salute teams. Their salute team, they promote veterans activities, health, stuff like that. Cavs Care, they do a lot of community work, a lot of work in downtown Cleveland. Two fantastic groups. Love working with them both, and I'm glad we worked together on this. So both years actually, we had so many Christmas cards because I asked all my fellow citizens here in Twinsburg, Ohio, to donate cards as well. Matter of fact, I posted on all my social media. So not only did we get people from Twinsburg and some of the surrounding cities and towns and villages, but we had people from all around the country send cards as well. In both years, we had so many cards that we brought cards to the Ohio Veterans Home in Sandusky, Ohio. Now, unfortunately, we were not allowed to go into that facility to visit with the residents of the Veterans Home, but Wade Park allowed us to visit with the patients. And a lot of them were extremely happy, extremely glad that we brought them some cheer. Because not only did we have Christmas cards, but the Cavaliers put together these little gift boxes. They had cookies and cards and brought T-shirts, Cavaliers apparel to the patients. So I discussed that with Chillicothe and Dayton, and they says, yeah, you can do that down at these hospitals as well. So we're going to not only start periodically throughout the year, bring puzzle books, but we're going to do Christmas cards every year at all three hospitals. And we had so many Christmas cards that we would have been able to done all four facilities. Thing is I need some volunteers. I need volunteers from Chillicothe, volunteers from Dayton. Matter of fact, if you live close to a VA hospital in the state that you live in and would like to help do this, the email will be in the description. All right. We want to spread this cheer throughout the country, not just here in Cleveland, not just here in Ohio, but every VA hospital there is. So if you can help us out, please contact us. We could use your help. It's not going to cost you anything except for maybe some gas to get to help bring the cards to the hospital that you live close to, or to go around to, like, if you put collection boxes in the city that you live in to get other people in your area donating cards. Hey, that's it. You might have to use up some gas in your car. That's about it. Oh, you're going to have to probably store some cards at your house until you can bring them to the hospital. But if you can do this, please contact us here at Veterans Assurance Network. The description or will have the email address in it. Also, the website for Veterans Insurance Network. Okay. Now, I'm not going to waste your time anymore tonight. You're probably saying, God damn it, Tim. Why do we have to listen to just you just ran on, man? Well, we were going to have a veteran on today to tell her story, but unfortunately, things happened. Unfortunately, she could not join us tonight. So this is what you got. All right. Hopefully, it was some good information to wake you up a little bit to look into Medicare, because they're going to make you look into it sooner or later, especially if you're on Social Security. They're going to make you get it. Right? It's inevitable. Might as well look into it now. Get yourself prepared. Like I said, become proactive. All right. So here we go, folks. 988. Then press 1. You know I do this every episode. You know why I do it every episode. Look, if I didn't care, I wouldn't be fighting for you all. I wouldn't be demanding a National Veteran Suicide Awareness and Prevention Day to help educate everybody on what's going on. Look, if you're a veteran and you don't want to call 988, you just don't know what to do. You're seeking some help. You don't know who to turn to. Contact Veterans Insurance Network. They will get you in contact with the right people. Okay? But if you are in crisis, dial 988, then press 1, guaranteed to get you connected with a certified, licensed therapist or counselor. All right? Now, not sure if this is going to happen next week or not, but it's going to happen soon. My dear friend Kevin Hensley is becoming an expert on hyperbaric chamber therapy. I'm hoping next week he can come on here and talk to you all about the advantages of hyperbaric chamber oxygen therapy. H-Bot. All right. Now, Kevin's a good guy. Kevin's a really good guy. I love him. He's my brother from another mother. Always will be, no matter what people say. We advocated together for the PACT Act. Wrote a book with 2 other people with him as well. So I'm hoping next week he can come on. If not, we'll figure something out for you. But until then, stay cool, stay calm, sign and share this petition. Help us get this September 22nd date nationally, all right? All right, we'll see you next week, folks.